All right, guys, so I'm super excited to have Dr. Arnaud Versluys here from living in New Orleans at the moment in the United States. He is the founding and managing director of ICEAM, the Institute of Classics in East Asian Medicine Worldwide. He is the lineage holder of the Tian-Zeng Lineage. He's been a teacher of mine for many, many years. I consider him one of the few, if not the leader in the field in the restoration of the clinical application of classical or canonical Chinese medicine. So very excited to have him here today. Welcome, Arnaud.
Thank you, Simon. Thank you for the invitation.
So
I was just talking to my wife earlier about how I actually don't accept any more podcast invites or conference engagement invites or anything like that. But then, you know, I said, well, but if Simon asks, I just have to say yes, you know.
That worked out well for everyone. So
yeah,
really interested, you know, the idea of these little talks is to open up, you know, for particular formulas for people just to discuss. You know, everyone's got all these little gems all over the world, and you know, when I asked you which formula you wanted to speak about, you came back and you said Gualo Chumaiwan and Juyu Tang, and I just thought, what? I have no idea what to expect. So I'm really excited. So why did you choose those formulas?
Well, aside from the fact that I really love these formulas personally, like using them in clinic, and also just from a formula architecture standpoint, I think they're very neatly designed formulas. So they're just really pretty formulas in my opinion. But I think a lot of people, when they think about formulas that contain the herb Fuzi, just think about a very overt warming formula. Like, you know, it's all about yang deficiency, internal cold, you know, those kinds of things. But actually, the beauty of a lot of the canonical formulas is what in Chinese we call hanwen bingyong, which is the simultaneous application of hot herbs and cold herbs at the same time. And that's really what makes formulas really beautiful and very balanced, right? You're not just, you know, when you need to, okay, you can throw something extremely hot at a problem and it's only hot and because your problem is only cold. But in modern times and in modern clinic and modern society, diseases are often much more complicated, and you know, it's never just a clear picture of only cold or only heat, or at least it's often not a clear picture of only cold and only heat. And so that's why a lot of these Jingfang, the canonical formulas, they have the benefit, because of their really advanced design, to deal with maybe some superficial cold aspect, but then underlying heat, or deal with some superficial heat aspect with underlying cold. So the formulas are very well balanced. And I've often find that these formulas are very applicable in modern clinic. And so I thought, you know, using that as a topic, there's a number of formulas that under that rubric that I can kind of discuss. And two that came to mind at the moment that you asked me was Gualo Chumaiwan and Juye Tang. But actually, if we really want to take it a step further, I would actually also put Yi Fuzi Baijiang San in that category, as well as, for example, Fuzi Xie Tang, or even Huang Tu Tang, right? Because they're always formulas, they're all formulas that have Fuzi in them, but it's Fuzi combined with at least one or more cooling herbs, right? For example, in Gualo Chumaiwan, you will have Fuzi plus Tianhua Fen and Fuzi plus Chumai, and Tianhua Fen and Chumai are both cooling herbs, right? In Juye Tang, of course, you have Fuzi, again, at the core of it, but again, you also have Juye, which is a Yangming heat clearing herb. You have Gegen, which is a Yangming heat clearing herb, right? So those are all cooling herbs in the formula. For example, Yi Fuzi Baijiang San, which is for intestinal abscess, right? You have your Fuzi again, but then you also have Baijiang Cao. And Baijiang Cao is a kind of an intestine heat clearing herb, right? So it's, again, a hot herb combined with cold heat clearing herbs, right? And then of course, Fuzi Xie Tang is very easy to understand how that is a cooling formula, because it has Da Huang, Huang Lian, and Huang Qin in it, but it also has Fuzi in it because the patient is constitutionally yang deficient, right? And then what was the other one I mentioned? Oh yeah, Huang Tu Tang is also one of the rare formulas where you use Fuzi and Huang Qin at the same time. So again, Fuzi and some other herbs in there that are at least not cooling, but then you also have Huang Qin in there that is an overtly cooling herb. And so that's what makes these formulas just like design-wise very cool, very nifty. Like it's a very advanced design. It's one thing when you're thinking of these formulas, like this, how do I phrase this properly? In clinic, you have two things. You have a formula and you can have a prescription. And those are actually two different things. A formula is what's on paper, what's been put on paper. That's what's standardized in the pharmacopoeia or in the textbooks and things like that. A prescription is what you prescribe to your patient in the heat of the moment in clinic, right? So when you're prescribing herbs in clinic, it's not that hard to think of using hot herbs and cold herbs at the same time, because you modify formulas and the patients have all these things going on, and you often end up following that rule of Hanwen Bing Yong. But to standardize an actual formula, turning it into a magistral recipe that henceforth is going to live through time and be like a blueprint for then other people to modify upon and to work with, that takes a different level of skill. And that's the level of skill that Zhang Wenjing clearly had. Like he just was able to design these amazing formulas that just blow your mind. For example, the fact that, this is on the same topic of Fuzi plus a cooling herb, the Fuzi, the modification of Yue Bi Tang plus Fuzi, right? For when a patient has also internal yang deficiency with external aversion to wind cold. That means that you actually end up with a formula that has shigao in it, as well as has Fuzi in it. And that just makes it so brilliant that he was able to have that level of understanding that sometimes, a problem can have a superficial layer of maybe some heat that might be caused by actually underneath having a yang deficiency, right? And that's, I think, why these formulas are just so brilliant, and that's why I also think in modern clinic, that's why they're so often used, because people's conditions are very complex now. Like the causal factors of illness are so varied, and it could be environmental pollution, it could be lifestyle, it could be contagious illness on top of that, and so you get these really weird mixes of problems that oftentimes just only using warm or only using cold might address a slice of the problem, but sometimes if there's a little bit of superficial heat and you're using and there's underlying cold, if you're using only a warming formula, you might temporarily flare the superficial heat, and the patient might actually not feel that good on that formula, right? But then when you go in with an actually only cooling formula, the patient might actually have an exacerbation of some internal symptoms, and so then they also don't feel good. So then, to come up with a combination by yourself, like to address both issues at the same time in a very well-balanced and measured way, so you do not exacerbate the root problem, but you also don't flare the more acute surface problem. It's hard to do that on your own. You have to be really good, and that's why it's nice to be able to study these Zhang Zongjing formulas, the ones that he's designed in the past, that give us good ideas about what we can do, like using, for example, Zhuye Fuzi combo, using Huangqin Fuzi combo, using Tianhua Fen Fuzi combo, right? Using Shigao Fuzi combo, using Dahuang Fuzi combo, Huanglian Fuzi combo. Those are combinations that when it's not just only about and using these few formulas, but it is learning about his thinking behind it and learning about what your possibilities are, right? So I think they're vastly important formulas, and I love using them. I really, absolutely, these are probably some of my, when I'm looking at it from a formula science point of view, I think these are the sexiest formulas alive. You know, they are just really, really pretty in how intricately designed they are.
It's so true. You know, you see some of these formulas when you first start studying formulas, and then you see. I remember in university when I saw Zhang Zhongding's formulas for the first time. It was like poetry. You know, it was like hearing a classical music for the first time, as opposed to like listening to Baba Black Sheep all these years, and then all of a sudden you're listening to Mozart. You know, and you see it and you go, you say to yourself, this is art in its finest. This is mastery, and it's such a fine line, isn't it? You know, when you're talking about balancing those formulas, you know, you can say, oh, I'm going to treat all these things simultaneously, or I'm going to treat one thing, and it's and that spectrum is so huge between trying to do everything and just trying to do one thing, and the fact that he is right smack bang perfectly in the middle. It is astonishing. It is astonishing. Mm-hmm. It's so easy to slip either way, isn't it?
Mm-hmm. Exactly. So when we're talking about practicing this medicine is supposed to be practiced as an art form. You know, the style of medicine that Zhang Zhongjing taught was definitely a gentry type of medicine. It was practiced by people of such a high level of education and such refinement that indeed they would also consider this to be an art form. And so it really comes down to the difference between, being, for example, using a different analogy, being a martial artist or just being a fighter. You know, like you can be very effective as a fighter. I mean, all you do is just spar and punch bags and punch, other people, and that's very effective for what you're trying to achieve. But being a martial artist, there's a little bit extra stuff that comes into it. Like there's codes of conduct, there are historical things that you need to learn. There's traditions you follow, respect that's necessary within the community, like all these things, and even the whole thing about it's a lot more about even learning about avoiding conflict actually than it is to use blunt force trauma to resolve conflict, right? The highest level of martial skill, according to Sun Tzu, being like the art of war that we call that, the highest level is just avoidance of the conflict altogether, because you cannot lose a fight that you don't engage in, right? And so this in medicine means minimal intervention, right? It's, any meathead can strike and land blows and like hit somebody into a pulp. And it's very effective if that's what you're after, if that's what you're trying to achieve, is to really kill somebody. Okay, a fighter is much better at that than a martial artist, right? But a martial artist, it's about conflict resolution. It's about doing things. Actually, you're trying to, even if you do have to resort to violence, you're trying to resort to violence that is applied with the least amount of force, the least amount of aggression to achieve the highest possible outcome. So in a medical context, this means minimal intervention with maximum efficacy. And that's why the Zhang Zhongjing formulas truly embody this. Like when you're looking at Ming and Qing formulas for contagious illnesses, they're very forceful, they're very effective, but they really approximate a broad spectrum kind of antibiotic approach in ways like we're just going to machine gun the shit out of the situation, and then hopefully, can I curse on this? It's okay, right? Like I'm not going to get in trouble, right? Okay.
Yeah, there's no under 18 allowed to listen to it.
So it's very effective. Don't get me wrong. I mean, Western medicine is very effective with those kinds of things, but you might have overextended your own abilities, and you might have just provoked a severe collateral damage, right? Which sometimes to put out a fire in the immediate future, that is maybe sometimes what's necessary. But the art of a canonical formula would be the style of a martial artist, which would be like, if I see, well, first of all, I teach everybody to live a wholesome life. if they don't listen, then I want to be able to spot people who have strayed from the path of wholesomeness, and I would like to correct them early on before the problem becomes too bad. Like if I see somebody who's like really a bit hungry, maybe I'll try to find them a little bit of work and a few chores to do around the dojo, lest they ultimately become too hungry and they have to resort to stealing, and then we have a problem on our hands. You know what I mean? So you try to you're using very subtle means. Well, first of all, education is the highest form of medicine. You teach people how to live a healthy life. You teach them, second, to spot illnesses before they become big problems, so they could come seek help when the problem is still in its very early stages. And so then ultimately, you know, you intervene, you start to intervene, and you try to always catch the disease early. So the intervention is very mild and very subtle, and therefore mild intervention, the chances of side effects and damage to the body are fairly mild as well, right? You don't actually want to go heavy-handed. You don't want to having to resort to the high doses of Shirgao or the high doses of Fuzi. I mean, we do use high doses of Fuzi, but honestly, we don't like it. We don't want to do that. That's not what we strive for. We would rather fix a problem with the gingers. We would rather fix a problem with cinnamon, you know, rather than having to use Fuzi. Of course, you know, you use it when you have to. And I'd rather fix it with a small amount of Fuzi also because, well, less chances for side effects and also cheaper for my patient, right? It's, you know, food is not an infinite resource. It's a finite resource. And so it's something that we need to cherish. So the martial artist approach or the medical artist approach is much more subtle than just, you know, the fighter. You're an artist. And so that's why when you then, long story short, when you look at the original Zhang formulas, they are little pieces of art in and of themselves. Like, you know, and there are little pieces of art. And you know, the thing with art is that when you haven't studied much about art, or you haven't looked at a whole lot of paintings, or you haven't looked at a whole lot of works of art, your ability to really truly appreciate it is limited, right? Like, for example, with classical music, you know, if you've only listened to one classical piece and you know, and you're listening to it for the first time, and it's maybe, let's say you're listening to like a very heavy Beethoven or something like that, you might be like, you know, this classical thing, it's not really my thing, you know, it's a bit intense. It's not really nice. It's not relaxing. Yeah, but that's because you haven't really listened to a lot of pieces. You haven't really, you know, maybe you should try to read a book about Beethoven and like learn about his life story and then appreciate the time he lived in and the you know, what drove him, what motivated him, like what he was trying to achieve. And then if, for example, if you're doing this piece versus that piece, you might realize that this piece was written at this time of his life, under these and these circumstances, or for this and that occasion, as opposed to another piece which was for a different occasion, right? If you're only going to listen to a requiem, well, that's a bit morbid, right? It's just really dark and kind of heavy, as opposed to listening to like a Mozart opera, which is very light and is supposed to be funny and entertaining. And so that's the same with formulas. Like when you've studied them long enough and you've appreciated them long enough, you start to truly see the actual, just the intricacies and the true art, the true mastery of its designer. You see the hand of the designer throughout, and that's just the beauty of it, right? And so the formulas are very artful. Prescriptions, which is what we put on paper when our patient is in the room, which is what we send to the dispensary to get shipped to the patient. The prescriptions are inherently already a little bit more ugly than the formulas are, because the prescription, it's something that, you know, it has a little bit more of a pragmatic approach to it. Like, you had this theoretical ideal upon which you then build, because you kind of modify it a little bit. And, you know, even in modification, there's rules to be followed. Like, you can still modify it and it could be very artful, right? But you could also modify it and make it very ugly. So like you said, there's a fine line where you go when you're using a formula in clinic and it becomes a prescription. In your dosaging, you can make it look pretty or you can make it look ugly. In your modifications, you can make it maintain its beauty, or you can make it lose its beauty. And in clinical efficacy, that is absolutely going to show itself. If you have a formula that ultimately kind of has become just another prescription, your base formula was beautiful, but you've kind of modified it so heavily that now it's just become another prescription. Chances are, the less artful it looks to you, also the less clear the clinical results are going to be, you know. And you've taken lots of my seminars, and you know, you've heard me say this before, you know, rule number one: the more complex the disease, the simpler the formula has to be, the simpler the prescription has to be. For the very reason is that, well, if something is extremely complex and has tons of moving parts and lots of variability, you want to make your treatment very simple, and then you'll be able to get a really clear feedback. Hello, this is my formula. Very gentle, not overdoing it. Of course, you have to choose the right formula. I'm not saying like you just throw a simple formula at it just for the sake of it being simple. It has to be the right formula. But don't try to do too much all at once if it's a complex illness, you know, and then watch the feedback. And from the feedback, you'll learn a little bit more about what's going on. You learn about the constitution of your patient. You learn about the course of action to be taken with this patient. And then you can start to modify a little bit, but you're very careful. So you kind of take the high road on things. Like when, you know, don't go down in the dirt with the illness, you know, don't start slinging mud at the illness, and the illness is fighting you and you're fighting the illness. And at the end, it just gets, you don't even know what's doing what anymore. So these formulas are works of art in their own right. Now, most of the formulas, the majority of formulas have a very strong central theme. For example, 75% of the formula is tonifying, or 75% of the formula is warming, or 75% of the formula, something like that. I mean, I'm just throwing a number out here, but it's a general theme, you know, and it's very obvious from the formula. And so if you're working with that kind of formula and you need to kind of modify it because there's a little bit of heat going on, or a little bit of this going on, a little bit of that going on, then you also, you know, might have to put some cooling herbs in or something like that, or some, if it's a tonifying formula, you have to put some moving herbs in it or something like that, right? And as soon as you do that, you're starting to kind of stray from the beauty of the original formula, and you might make the formula a little bit uglier and a little bit not so effective, right? That's just what's going to happen. And that's why it's important that, to come back to the topic I wanted to talk about, it's important that you are aware that there are formulas already designed by the master that have built-in hot, cold, and draining, moving with tonifying and so forth, already made inside of it, right? And I think that's kind of what this is about. Often, you know, I'll hear a patient, or a student, and be like, "Hey, Arnaud, I have this patient, and they're really young deficient, but you know, actually they're having some damp heat symptoms, and you know, what do we do with that? Like, how do we treat their young deficiency but they also have damp heat symptoms?" And I would be like, well, there's formulas for that, you know. Gualochimai one is a good example for that, you know. And so then they're like, "Oh wow, I didn't know there was a formula that had foods but also has some damp heat clearing herbs in it," right? And so then they're like, "Oh wow, I wasn't aware of that." So rather than trying to design your own prescription that has heating and cooling and at the same time, inevitably, if you do it yourself, it's not going to be the same as if you did it with Zonlunjing, because Zonlunjing's formulas have a very long history of being used effectively in clinic, both effectively and safely in clinic. So it's safer to use something that's been used for 18 centuries and is still in use, which means it must not be that bad, otherwise we would stop using it, right? So it's safer to use the original formulas. And that's kind of why I want to bring these to people's attention.
And so I've heard you say in the past, you know, when people are learning formulas for the first time, is there a strategy that you think that's important for students? I think, you know, I've heard you say, you know, starting from 3 years or 5 years for unmodified formulas and kind of moving through that. Can you just remind me what you were talking about then?
Yeah. So there's learning formulas and there's using the formulas, right? So what you're referring to, the 3-year cycles, that was about the use of the formulas. Tian Lineage, under Dr. Tian, my teacher's teacher, right? They had a rule, which was that, okay, you're going to learn the formulas and you're going to come to clinic and watch me use them. When you then go, after you've done your internship with me, when you then go and you see your own patients out there, the first 3 years of being my student and using the formulas that I'm teaching you, you weren't allowed to modify the formulas. Like Dr. Tian, I mean, people still did it, don't get me wrong, but Dr. Tian always stressed the fact that the first 3 years don't modify. Because if you start out by modifying the formulas from the beginning, your starting point is always going to be a modified formula. So if you've never used Xiao Cai Hu Tang unmodified, and I'm not talking Xiao Cai Hu Tang as a patent medicine in a pill, tea pill, or something like that. No, that's not what I mean with unmodified. Regular formula, in China, of course, we always use bulk. In my clinic here, I use granules, but regular formula, but you use the original dosages and you don't start adding things to it. You just use the regular formula as is. And if you do that for 3 years, you will have developed a very good baseline understanding of what is the applicability of the formula in its unmodified form. How, let's say, using the example of a sore throat, how bad of a sore throat can still be tackled with Xiao Cai Hu Tang in its unmodified form. Because if you're saying, oh, I have a sore throat patient, I think it's Xiao Cai Hu Tang, but I'm worried that Xiao Cai Hu Tang is not enough, that worry is not coming from anywhere. That's just your own insecurity. That's not based on something scientific, right? It's just your own insecurity. But because of that, you add some Jiegang, or you add some whatever, maybe TCM modification like Shenzhen or something like that, and you use the formula like that, you're only learning about what Xiao Cai Hu Tang plus Jiegang and Shenzhen is doing. You're not learning about what Xiao Cai Hu Tang is capable of doing, because that sore throat might have already responded to just Xiao Cai Hu Tang, but you did more. Sure, the patient maybe comes back and is still better, but you didn't learn anything, right? And so that's a problem, because again, coming from the martial artist point of view, coming from the vitalist point of view, like the principle of, like a naturopathic principle of that you always protect the vitality of the patient, and you always, that the healing happens because the patient's vitality is doing the healing, not your herbs. Your herbs are just a messenger. It's the patient's body, the vitality of the body, that's doing the healing, the Zeng Qi. You always protect the Zeng Qi. And less is always more. And doing more might also have more collateral damage to the body, right? So that's why you have to trust in the Zhangnongjing formula. So Dr. Tian would always say, use the formula unmodified for at least 3 years. Then the second 3 years, Dr. Tian would say, okay, well, now that formula, but not just any crazy modification. No. You can modify only using original modifications. And the original modifications, they are in the text, right? Xiao Cai Hu Tang has all these original modifications. For Xiao Cai Hu Tang patients with lots of thirst, right? Ban Cha out, Ren Chen up, Tian Hua Fen in, right? Xiao Cai Hu Tang patients with abdominal pain, plus Bai Xiao. Xiao Cai Hu Tang patients with difficult urination, Huang Qin out, Fuling in, etc., etc., etc. So all the standard modifications that you see in the actual original text. So because who better to know how to modify a formula than the man who has designed the very formula, right? And I always give the example, is like, okay, you're buying a nice car, you buy a BMW, but you want to make it better. You want more horsepower. You want more, whatever the stuff is that they do to cars. Like, you're not going to go to a Toyota guy to figure out how to make your BMW better. No, you're going to go to a BMW guy, right? He's the guy who designed it. He's going to be able to tell you right away, well, we've designed it as such for a reason, but if you want to do something, this is what you should do to have this or that effect, right? So the same thing, if you want to modify a Zhangnongjing formula, ask Zhangnongjing what the best way to modify that formula is, because he's the one who designed it. He had it all in his mind. It's all part of his universe. And so that is the second 3 years. Now, when we teach modifications in our training, we have what we call implicit modification and explicit modification. The explicit ones is where Zhangnongjing himself says in the text, for this extra problem, use this extra herb, right? That's it. He explicitly tells you how to modify a formula. But the implicit modifications might be where he modified a formula to address an extra symptom, but he just renamed it into a new formula, right? For example, Guizhi treats, stiffness of neck and nape, mild fever, some sweating, right? Wind aversion, right? Basic symptoms. But if the stiffness of neck and nape also extends into like more the shoulders and the traps, and it's more rigid, then you do Guizhi Gugen. You add Gugen to that formula. But then instead of saying like if there is stretched stiffness of the nape, add Gugen. Instead of making that a modification postscript following Tang, he just said, well, no, that symptom is so common that actually we're just going to make that into a new work unit. The new work unit is going to be called Tang. So he calls it a new formula. But to us, it's very obvious that it's a modification of Tang, right? And so that's what I call an implicit formula modification. And so you can still use those as well. Like, I don't know for a fact whether Dr. Tian looked at it that way, but for studying purposes, I think this works well, right? And so that was the second 3 years. And then the final 3 years of your 9-year discipleship, which is the traditional length of a discipleship, the final 3 years, then Dr. Tian would say, okay, now you can start combining formulas, right? And combining formulas is something that Zhang also does, right? Zhang, for example, for Taiyang and Shaoyang coexisting disease, he has, for example, a Chai Hu Guizhitang, right? It's all the ingredients of Xiao Cai Hu Tang are in it, and all the ingredients of Guizhitang are in it. And it's basically two formulas together, but he renames it into Chai Hu Guizhitang. He gives it a new name. It's so common in clinic that actually he says, instead of just, getting all verbose about, well, in case of coexisting Taiyang symptoms of a wind strike nature, you can also incorporate a full Guizhitang. No, the man was scratching this stuff on bamboo strips. That was way too verbose. He just said, okay, for coexisting disease of Taiyang and Shaoyang, Chai Hu Guizhitang, right? You can have a new unit, a new work unit, a new formula that he would create. But actually, we know by studying it that it's a modification. So that's what we call formula combination, right? Or Dr. Tian called that skillful treatment. He had a term for that. And so that, because it's more skillful, because that level of modification, it makes the formulation, it makes the prescription a bit more complex. It's just more stuff going on, right? Because now you're looking at what herbs are in common between these two formulas, and you're trying to architecturally fit them together, so they speak a common language and make them work as a team, right? It takes a little bit more skill. And so that's something that you could only do after 6 years of already being in the system with him. And so that was then the last 3 years of your training. And then after 9 years, you could basically modify however which way you wanted in clinic, right? When it comes to studying formulas, the first part of your question is like, how do you study formulas? I mean, studying formulas is kind of a blood, sweat, and tears kind of situation, It is hard work, but anything worth doing is going to be hard work. I mean, that's just how it is. I mean, you're looking at in usable form, which means like some formulas, there are ingredients in them that are hard to find. Some formulas are very obscure. Some formulas are so strong that they're kind of, unless you have really good skill, they're maybe a little bit hard to handle. But in good usable form, you would have at least 280 formulas within the system, right? And so you're going to have to memorize them all. There's no way around it. Like, you can't just sit there with a book in your hand, like you have to memorize them. And so I believe that memorizing formulas has to be looked at. It's a lifelong journey. Like, it is something that just keep it up, right? It's like the old man that you once met who can still do 100 push-ups. And you're like, oh my God, how can you just like do these, you just like bang out these 100 push-ups, like no problem, right? How are you able to do this? He's like, well, I never stopped doing it. I've done that since I was a young man. I did 100 a day since I was a young man, and I'm still doing 100 a day. And it's no chore for me. I'm used to it. I have the muscle memory, and that's ultimately what you need to develop when you're studying formulas. Now, the most effective way of then cramming them in your head, I think, other than you have to find out what your study technique is. What is your optimal study technique? Do you need to recite it? Do you need to record it on tapes and play it during your sleep? Do you need to, like, I don't know what you need to do, like write them down over and over and over? Everybody has a different technique. You've all been to uni and graduate school and all that. Like, that's something you figured out by now. Like, we're not here to teach you that. But the best way to organize the formulas to make it easier to study is to put them in formula families, right? And that's why when we come to, like, for example, these food formulas that I'm talking about that are also cooling, right? They're foods formulas. They're formulas that have foods in them. So what we call foods of family would be all the formulas of Shanghanlun and Jiguayale that all have the herb foods inside of it, right? And when you can write them all out, right? And then you can start to organize them. Well, these are foods of formulas that we use more for surface releasing. These are foods of formulas that we're using more for specifically the cold hands and the diarrhea with undigested food. These are foods of formulas that we're using for abdominal pain. These are foods of formulas that we're using for this, that, for water metabolism, urinary symptoms, right? And then those are like some big groups. And then you'll end up with a couple of stragglers. You end up with a couple of formulas that are like, where do these guys fit in? And it's often those are the ones that I'm talking about here, because they have foods that they're warming the imperial fire on the inside of the body, warming the small intestine, warming the heart, but they also have some cooling in them, right? Yi foods about right? Gualo Chumaiwan also cools the bladder and the triple warmer, right? Zhuye Tang cools the lungs, cools the skin, right? The Yuebi Tang plus Fuzi, right? Same thing. It cools the lung, it cools the skin, right? Fuzi Xie Tang, again, it warms the small intestine, but it cools the stomach and the large intestine, right? So you can just call that group of formulas the foods of formulas that are also cooling, if you want to do it like that, right? And so you kind of put these formulas in groups, and you'll start to see patterns, because it's all pattern. Like this whole system is a modular system, and you just have to start to see the forest for the trees. Like initially it's all confusing. You're like, oh God, how am I ever going to do this? But once you realize that, there's maybe about, 40 formulas that are based off of a Guizhitang, and all of them, the only thing they are is just slight moving arounds of herbs and swapping them out and changing Senjiang to Ganjiang and whatever, things like that. I kind of keep the train of thought going. I'm able to actually memorize these formulas much more easily. And so using formula family concept is a brilliant concept. It's probably the most effective concept, I think, to learn, because you learn through understanding. You're not doing rote memorization. When I was in university in China, it was all rote memorization. Rote memorization is the great equalizer. I don't know how universities in China are now, 21st century. But when I was in university in China, everybody had to be the same. It wasn't really promoted that one person was this really talented genius and we would give this person like a place to shine. That just never happened in university in China. Everybody was the same. Nobody should stand out. Like they didn't promote the individual talents of their students. And I think this just comes from the whole political climate that China, the political choices they've made over the last half century. And so memorization is the great equalizer, because every human being can memorize. The difference is the talented, brilliant person might memorize the same packet of information in 1 hour and ace the test, while the less than brilliant person might take 2 hours to memorize that packet of information and still ace the test. But the memorization is done within the confines of your study, within the confines of your private residence, of your dormitory. And so nobody saw how much effort the individual had to put in to ultimately have the same end result. So it was the great equalizer. But it was extremely difficult for me because I grew up in Belgium and I was raised, with the principle of you want to be taught to understand. Like the test questions were always like, explain in your own words, blah, 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 right? And so that you learn to think, you learn to like, kind of, how do I put this in different words? How do, you develop the insight. And in China, the test questions was always, answer this question using the words of the textbook. Literally, that was the text, those were the exam questions. And so you were never actually, nobody cared whether you understood. People only cared whether you could reproduce it on a test. And so it was very challenging for me to just have to memorize. Like our Shanghanlun class, our first Shanghanlun class was just like basically memorizing about 45% of the actual clauses of the text. This was horrible. It's horribly boring, horribly dry, and just plain difficult, because like without the context of the understanding and some maybe clinical anecdote that goes with it, it was just virtually like impossible for me to be good at that, So my grades were mediocre, middling grades, and not good grades at all. I'm very shy to show my grade transcript to anybody. Of course, once we got to clinic towards the later years of my training, of course, then my former upbringing in Belgium, being taught to think for myself really helped me along well, because then I was better at analyzing problems, I would say, than my average classmate. You know, Chinese kids are just so freaking smart, man. Like I just could never keep up with them. But when it comes to free creative thinking and thinking outside of the box, specifically because in clinic, that's what you need to be able to think out of the box. Because, you know, the character might be vexation, fine, restlessness, right? But in clinic, that might manifest actually as itching, because itching is very vexing. You know what I mean? So if you're able to think out of the box, then all the formulas that mention restlessness could also all of a sudden become applicable for people who have itching and skin issues. You know what I mean? So it opens up that whole category. You're not just combing the text for, where does it say itch? Oh, wait, there's only one line in the whole Shanghai that talks about the character itch. Darn, there's only one formula in the whole Shanghai that treats itch. Well, that's obviously not true. Right? So you see, like, so it needs a creative way of approaching it. I'm so verbose, it's terrible. Maybe we should do 2 sessions.
Well, you know, I think this is actually turning into a how to understand formulas more than a particular formula. So I'm curious, you know, to see how, I mean, because we started talking about, you know, seeing a formula that's actually sexy, that appeals to us creatively and artistically, and appreciating it from that sort of that sort of standpoint. And you use a lot of metaphoric language in your teaching, and you know, as we've seen as well during this. And I remember, I'm curious to learn about that, but I don't know if you've seen the movie Il Postino. It's about who is it? It's one of the famous. I can't remember the author. It's a Cuban author. Anyway, super famous. Can't remember, but he has this relationship with a simple postman. And he's trying to explain the concept of a metaphor, and he's saying, you know, this is a metaphor, like, and he gave this poem, and it was about the sea, and the way he delivered it was very much, you know, back and forth and back and forth. And at the end, the postman said, you know, that poem about the sea made me feel seasick. It made me feel like I was riding the waves and I was on that boat. And he said, aha, that is a metaphor. And then there was this pause. And then the postman said, I think that everything is a metaphor of something else. And it was amazing. And then Pablo Neruda, that's who it was. Pablo Neruda sort of walked away and said, I need to think about that again. So I'm curious to see where you develop this kind of metaphoric language, and how that helps you understand. I can see how you understand formulas this way, and it's such a great descriptive way of doing that. Where did that come from, and how has that helped you in your understanding of the formula architecture?
I don't know where it comes from, Simon. I think that's just how my mind works. Like, I have images, like, you know, I have a good ability to visualize. I have images in my mind, and I used to like to draw and do art school and things like that. So maybe that's where it comes from. Like, but also I draw a lot on just like examples from life or anecdotes, or it's like a parable. Like, you know how the Bible teaches through parable, right? It's kind of the same thing. Like the whole classic, all the classical writings of that time, they kind of teach through parables that could be abstract in like Taoist things, or in like, you know, like Chinese like mythology, like or like Greek mythology. Some of the parables, the stories could be very abstract, but they could still teach you something highly applicable, right? And so, but they, you know, like whatever, you know, don't bite the hand that feeds you. Like, you know, that's very real. Like a dog, if the dog bites the owner is going to stop feeding it, right? And it becomes an idiom. It's like a story that teaches you something, but it's a very real life example. It doesn't talk about Dungeons and Dragons, for example. You know, I don't know. Like, I think that the abstract way of thinking naturally creates imagery. And so, and I actually think that the whole Huangdi Neijing, I'm not a Huangdi Neijing scholar, obviously. Like, I cherry pick parts of the Huangdi Neijing that fit my needs to better understand my formulas, better understand how my teacher diagnoses, how my teacher thinks, how Zhang Dongjing thinks, right? So we use some aspects of the Huangdi Neijing, not every freaking chapter or every freaking clause of the Huangdi Neijing, but the way they have written the book in my opinion, and the way that all those canons have been written, all those canonical writings have been written, it's evoke something within the reader. What it evokes is completely up to the reader's paradigm and the reader's momentary need. If you're reading the Neijing and you have a particular clinical question, whatever the certain passages will evoke within you will have something to do with your question, because that's what the intention you came in with, right? And so when I'm reading the Neijing and I'm trying to better understand the workings of yin and yang in correlation to the sixth qi, for example, right? Then basically I will look at certain clauses through that lens, and it'll inspire me, and it'll create inspiration, it'll create imagery, it'll create an understanding that is pertinent to what I needed to do for me, right? And that's why, you know, when it comes to like translating the Honi Neijing, right, or any type of translation of any type of canonical text, there is, I'm gonna say like 50% or so is of course what the letters and the words actually mean from a linguistic point of view, but the writers of those texts have never intended to limit you. As a matter of fact, they have intended to unlimit you when you read it. Their intention has been to write in not absolute concrete ways, but to keep it kind of open for interpretation, to keep it kind of abstract. So when an acupuncturist reads about qi, to them it means something. When an herbalist reads about qi, it's something else. When a qigong master reads about qi, it's yet something else. And when a meteorologist reads about qi, it's yet again something else. But they're all reading the same lines in the same chapters. And that's, in my opinion, that is intentionally written that way. But it's intentionally written that way, though they might not have known that they were doing that. It's just how they thought in those days. And that's why reading those books are extremely important, because we're trying to practice a medicine that is 2,000 years old, but our brains no longer work in the ways of 2,000 years ago. And so how do we transport ourselves? How do we teach our brains to work that way? How do we learn to think in Han Dynasty ways? You have to read the original texts. Right? Doesn't mean you learn your clinical skills from that immediately, not right away, but in understanding all the imagery that it's going to evoke, the aha moments that you get, those kind of just like romantic, heart-wrenching feelings you get when you read a sexy Neijing passage, right? We've all been there. Like you read about the elements or the organs or the 12 officials or all those things, yin and yang and all that. It just kind of blows your mind, and you have this kind of goosebump moments. That's exactly what this is intended to do. That's how it creates new pathways in your brain. That's how it's written in such a way that it'll take you out of the 21st century into a first or second century state of mind. And once you're in that mindset, that's when you learn how to practice Chinese formulas and Chinese acupuncture. Because when your mind has been transported to that mindset, then you start to read the Shahanan lines differently. You start to think about things differently. You might realize that vexation could mean itch. That a person who is very itchy, actually what they're describing is that they're super, super restless. You know what I mean? And so those formulas become applicable. So you have to transport yourself to the Han Dynasty, and it has to be done through study of the classical text. There is no other way, because we're 2,000 years removed, right? And so to learn how to think in Han Dynasty ways, you have to read the Neijing. For Chinese medicine purposes, right? Now, if you want to, Taoism or legal scholar or martial scholar, like, military scholar, you have to read different texts, like there's the 8 big schools. But for medicine, you have to read the Neijing, the Nanjing, the Bentao Jing, and so forth. Even though it might be confusing, it's of course confusing. It's 2,000 years old, and it wasn't supposed to be interpreted in a very black and white way. It's supposed to evoke things within you. It's supposed to open things in your mind that you didn't even know were closed. And all of a sudden you start to think differently, and you start to work differently in clinic.
And so do you think that, I totally agree. Some of the commentary you read on the Jingwei or the Shahan Lun, you read this commentary and it's just so boring. It's so, oh yeah, this and this herb are good for the spleen, and this herb strengthen the kidney young. It's just not the way people were thinking about the formulas.
Listen.
It's just not, is it? You know, and so that's why you kind of, you know, you go back to those lines and you just read them. Do you think it's a good idea for new students of these canonical texts to just read it just straight up and just go with no interpretation? It's kind of like learning a new language. That's why kids learn so much faster, because they have there's no preconditioned ideas of what this should be and what that should be. You know, you hear so many complaints. Oh, I just want to hear I don't want to learn the pinyin name. I want to learn it in English because no, but the pinyin name has other meaning that you don't yet understand. Let yourself learn it, you know, rather than have an interpretation and put all these preconceived ideas onto it. Yeah.
Now, you know, I would like to caution one thing is that if let's say you want to become a good tracker in the bush, in the woods, right? How much time do you have on your hands to let yourself get lost over and over and over and find your way back to your car and hoping that it's still there and hasn't been vandalized? You know what I mean? Yeah. Like, so there is merit in having a teacher because, you know, the teacher will basically tell you, okay, we're in the woods now. And for example, that path over there, you see those hills. Actually, you shouldn't take that path. Because I took it once, and actually, you know, there's like some nettles over there, there's just like some bad snakes over there, whatever. You don't want to go down that path. That is a detour. Or you see this path over here, it looks very easy, it's nice and flat, but actually, once you walk it, it'll take you 2 hours, and it'll actually put you back here, and you won't actually have gone anywhere. So a teacher is somebody, that's why we draw upon the experience of our elders. You know, we are being invited to stand on the shoulders of giants. It truly is that. Like, the teacher has spent his or her life navigating these woods and has figured out an effective method of, you know, walking without getting tired, not drinking too much, not getting overheated, you know, like, don't make detours, don't go down those types of things, even though they might look inviting. Like, they have figured out how to do it. And you can, in a very short amount of time, accumulate a vast amount of knowledge. You can basically distill the essence of their whole lifetime of walking, right? And the essence of their one lifetime of walking actually was also fed by their teacher's whole lifetime of walking. So you just saying, like, I'm gonna pick up the Neijing and I'm not gonna go to a Chinese medicine class that talks about, you know, yin and yang, and I'm just gonna read the Neijing chapter by chapter over and over and over. You will ultimately be an amazing Chinese medicine scholar and clinician, but it'll take you 50 years before you're even capable of starting to see patients, right? There's a lack of pragmatism and applicability that comes at the end of it, but, you know, it's not going to happen. To go back to the martial arts metaphor, you know, you see a lot to do now on in China, for example. There's these MMA fighters who challenge these old traditional martial artists, these shifu, right, to fight them in a duel. And of course, the MMA guys totally destroy the Chinese masters, because all the MMA guys train is to destroy and dissemble another human being. Like, all they do is spar. And the Chinese masters probably have never sparred in their life, except maybe when they were young, maybe a little bit. But even then, it wasn't really intended to just smash somebody in a short amount of time, right? Now, if a Chinese master were to practice traditional martial arts for 50, 60, 70 years, right, but not age and stay fit and healthy and young, maybe at the end of that journey, that mastery would still be able, they have the skill and the mastery, but it's still paired with like that youth and brawn, then maybe they could win a fight from an MMA fighter. But because that's not how the world works, it's impossible that an old master is going to beat a young MMA fighter. Like, it's not like in the fucking movies, you know, like the young martial artist who is jacked up and on natural testosterone, and all they do is to train to fight, is going to destroy the traditional martial artist every freaking time. That's just how it is, right? But that doesn't mean that traditional martial arts are obsolete. No, the skill that you acquire over a lifetime of doing that is vast. It's unbelievably vast. But it doesn't mean that, you know, that that you would, so you read the Neijing your whole life, you'll have tremendous skill, but then you finally start to see patients. You don't have enough time to make a difference in the world. You don't have enough time even to put that knowledge to use. And so, yeah, then you have, then why did you do all this? Like, it's kind of futile. So you do need a teacher. You need a master who is going to impart their skill without holding back, give it all to you and tell you where the pitfalls are, where the shortcuts are, what to do, what not to do, and save you a lot of time. And when they do that, and when you follow a master like that, the end result is that you can exceed your master's abilities and skills. And that's exactly what the master wants. Like, why would I want to teach a student who's dumber than me? No, I want to teach a student and make them smarter than me, because that's when I will know and feel that I've succeeded. Right? I was that springboard for you to just go to next level heights that I've never reached because I ran out of time. That's ultimately how it happens. And the continuation of the knowledge is that you just like lift other people up, and they're going to go higher and higher with this, hopefully. I mean, if they put the same amount of effort in, which is of course a problem in modern society, that level of commitment and the excessive level of distraction in our society is putting a bit of a downer on that. But if were to say, okay, theoretically speaking, if the same level of hard work is put in, then the person the disciple will ultimately make it farther than the teacher. That is the natural law of things, and that's of course what we encourage. That's what we want. So you do have to need a teacher. It's very important.
Yeah, a lot of people, when I talk about the different teachers that I've had in my life, often people don't get like how you find those people. I think, I don't know how it was. I know how it was for me. So how was it for you? Sort of, what was the motivation to go and find these teachers? People most people in Australian culture are just, what's the word? Have these massive expectations of everyone, have these, they're just completely like, excuse me, like I'm the shining center of the world, and, you should give all your information to me without any intention, without any motivation. But there's other people who, but they know it deep down inside, they know I really need guidance here, and we have no spiritual, no spiritual or professional assistance. And so I can see how quickly they get lost. And so I remember for me anyway, like, the idea of an authority figure was just completely ridiculous. It wasn't until I met my, the monk that, he made me dismantle and re-establish a compost bin over and over and over in different parts of the monastery. And that's when I was finally humbled and realized that he actually had the intention of teaching me a lesson, and I had never experienced that before. And from that moment on, I realized I actually got to look up to people that have the knowledge, and it made me go out and seek people with this authentic knowledge. Do you think it's do you think it's the intention that you need to have? Is that the fundamental thing that you need, or is there something else to find that person? I mean, I know you found it.
Yeah. I mean, there's a metaphysical aspect to this question, there's no way around it, that we're going to have to ultimately conclude, like, I'm a Buddhist, so I'm going to call it a karmic connection with somebody, the Chinese have a saying, like, what is the thing, like, when the student is ready, the teacher will appear, kind of a thing. And that can go both ways. That could be good, could be bad, because when your karma matures, you could, maybe it's bad karma that matured, maybe it's good karma that matured. You could have a good teacher or a bad teacher, somebody who, you thought was really like teaching you good things, and 5 years later you realize, like, this isn't going anywhere. This happens a lot as well. But I think the first and foremost, like, if I just share my own story, is like, I went to China at 18. I enrolled in the bachelor's program, bachelor's in medicine, which is the basic 5-year program, and very, bright-eyed, bushy-tailed, as we say in America. And so, go there and I'm so naive, and I'm learning everything, loving everything, and I didn't have the critical ability to really assess, like, what I'm learning, the validity of what I'm learning. You know, like, am I learning really valuable things or not? In the beginning, you don't know. You just go along with it, right? Then I got to my year 4, and that's when you do Neijing and Changhan and things like that. So in the meantime, you've done some interning in clinic and observing in clinic, and you realize, like, man, this isn't working as well clinically as I thought this was going to work. Like, I came to China believing in these fantastical abilities of Chinese medicine, you know, and believing that this ancient medicine is like, this is it. Like, this is going to cure all diseases in the world. And then you go to these hospitals in China, and there's big professors and big names and big department heads and all that. But when they're actually, excuse me, in clinic with their patients, the results, I was like very skeptical. I was like, man, this might as well just be placebo. Like, the patient is just kind of a little bit better, but maybe, I mean, are they really better? Like, they, you know, is there truly demonstrable, objective, positive changes happening? And so I was very critical, and I wasn't very impressed. And I'm like, well, I didn't believe, and that's the good thing, I didn't become a cynical person. I did not blame Chinese medicine for that, but I blamed how it was practiced. Like, I realized pretty quickly, you know, what everybody is missing is that everybody's trying to make it modern and trying to make it integrated and trying to make it this and that and the other. And that's obviously not working out because the clinical results just are not really there, you know? And so, because the patients are also doing Western drugs, so maybe they're just getting better because of their Western drugs. I mean,
it's a hard realization, isn't it? It's a hard realization. Most people just give up at that point.
Tough realization, yeah. So I realized, sorry, I missed you there for a second. I got stuck. But I realized that the answers to the riddles of Chinese medicine, to the things that the deeper knowledge, the answers to my questions, the only way to achieve clinical mastery, it has to be in the classics. Like, once I started learning Shanhan Jingui, Neijing, I'm like, this is it. This is the shit. This is what I came to China for. It took me 4 fucking years, but finally it's here. Yet I don't understand anything of it, what it means, but I know it's in here. I know it's in here. But in school, in the classroom, I was not going to get the answers in the classroom, because in the classroom it was like, okay, everybody, let's recite these lines, or what's this character mean, or something like that. I'm like, fuck, this is not it. The answer is in there, but this is definitely not the way to get the answer out of the text. So I realized, like, there has to be a different way. There has to be a different way. And I said, I need to find, and I don't know how I came up with that, but I said, I need to find somebody, like a master, like an old doctor, like a tutor, whatever you want to call it, who's going to sit down with me one-on-one. Like, I cannot do it in these big classrooms and these departments and big hospitals. I have to find somebody who's going to sit down with me one-on-one and explain it to me, like, how did you get to the understanding, right? So I said, I need to find a master. So midway through my 5th year, I was going to do my 5th year. 5th year is your internship, right? So it's a whole year of clinic, 46 weeks of clinic. And so I said to my university, I said, you know, I'd like to do half of that year in a different university. Can I, you know, still get credit for it, you know, pay tuition and everything, but I want to go out and find other professors and stuff like that. And so I had contact with some professors in Beijing. I went to Beijing, and I had the experience of following this one particular professor, one for acupuncture and one for herbs, just those 2 people for about 4 months. And that was like, it was still not a classical person, but at least it was a lot more of a classical way of learning. And I started to realize, like, okay, I guess this is what I know what, this is the method, this is the way to do it. And so then I went back to Hubei, to Wuhan, where I was doing my undergraduate, and I finished all my requirements for the rest of the year and did all my department things. And I said, well, you know, I'm not going to stay in this school. They wanted me to stay there. I'm not going to stay in this school. I want to learn more herbs. So I wanted to go to Sichuan, to Chengdu University, because they're more known for herbal medicine. And I wanted to learn more Shahanlun, because I felt like that really was what drew me. Now, you could say that's karmic too. Like, I am convinced that I have read that text before. Like, this is not the first time in my long chain of lifetimes. This is not the first time. I mean, I doubt that. I feel too akin to that whole intellectual movement for it to be just the first time. It makes no sense in my worldview of my life philosophy. And so I went to Chengdu, And I went to Chengdu, and I had the whole summer before my year was going to start. And how exactly? I was hanging out at the Buddhist temple there. And because I wanted to meet this old monk, like there was the old abbot of that temple, the Zhaojue temple in Chengdu. The old monk who was the abbot there, he was 100 years old already at the time, or 99 or something like that. And he was very well known, but he actually was of a Tibetan Buddhist tradition, of the Gelugpa tradition, but he was a native Chinese. He actually had, his teacher had walked to Tibet in like early 20th century. And he was a Chinese man and learned Tibetan and all that stuff. Anyway, it's very famous. Qingding Fasher was his name. And so I was waiting there to meet him. And I waited for 3 freaking weeks. Every day I just sat there at the monastery. After a while, I just got bored. I just started working in the kitchen and started sweeping the floors, just helping out, because I'm going to sit there anyway, waiting for him to show up, because he didn't always come to have audiences anymore because he was so old. And so ultimately got to meet him, became a Buddhist, all that stuff. And then something changed in my life, honestly. Like, I mean, this sounds really strange maybe, and I'm not trying to be like super metaphysical here, but it is kind of like, when I look back, it's like this was a pivotal moment for me. Like, somehow I stuck it out in that temple for weeks in the heat, sitting there. I could have gone back to Wuhan so many times, but no, I just stuck it. I know he's going to come, and I know he's going to come. Today's the day. Nothing happened. Today's the day. So I stayed there for another week, because then I was given some Buddhist texts to learn to recite them, and then I could ask questions to some of the monks, about if I had any questions about the text and things like that. And during that week, I met a lady who, long story short, she knew Liu Lihong. And so Liu Lihong is this man, this professor in China who's all about Renaissance of classical Chinese medicine. So, and she was a disciple of a Tibetan master, and he also was a disciple of the same Tibetan master. And so that's how I met Liu Lihong. And I asked Liu Lihong, I said, I really want to come to Chengdu. Like, I love this temple. I've now taken refuge, and this is now my spiritual teacher. I want to be closer to Tibet because I really feel drawn to that. I said, I want to come to Chengdu. Who do you suggest I study with in the university? If I want to transfer here and do my master's in Chengdu, do you have somebody you can advise me to study with? Like, who's open to the classics? And he advised me to study with Deng Zongjia, who taught formulas. He was the head of the formula department. And then my second question to Liu Lihong was, do you know of a person who's really good at teaching Shanghanlun, but who's not part of the university? Who's like just a folk physician who's really good at Shanghanlun? And that's how he introduced me to Dr. Zeng Rongxiu, who was a disciple of Dr. Tian. And that's it. From that moment onwards, I think I can say I was finally on the path that I had to be on. All these years leading up to that, I was 22 years old at the time. Those 22 plus years leading up to that, everything was in service of that moment. Being able to be in Chengdu, making those Buddhist connections, because that is still what my life is about, and making the connection with the Shanghanlun teacher, Dr. Zeng Rongxiu, which is still this is why I'm even having this freaking podcast, right? It's because I have something to say about Shanghanlun, and everything I have to say about Shanghanlun is because I had a teacher who knew what he was talking about, right? So that's really how that happens in a traditional way. Like, traditionally speaking, my teacher had maybe 3 or 4 students. Dr. Tian had maybe 4 or 5 students his whole lifetime. Traditionally, that's always how it was. It was slow production. It was small scale production. Like, there wasn't classroom style production. But then I have been so passionate about this that I'm like, well, no, I mean, this Chinese medicine is going to shits, this is getting really, really bad. They're trying to modernize it. It doesn't work anymore in clinic, and so I felt very strongly about the Renaissance movement and keeping Chinese medicine, the old style of Chinese medicine, alive. And I finally knew how to practice it. And trust me, I'm still learning a lot. And I still keep getting better. Like, every year is a little bit better, and sometimes the progress is little. Sometimes I make breakthroughs. Every year it's still a little bit better. My understanding gets a little bit better, and I can't wait for next year and the year after that, That's just how it is. But I really decided that if we're going to continue with this small scale production, Chinese medicine is dying faster than I can produce new talent. So I need to open it up. And so I said, okay, we need to start teaching these pulses in a larger setting, you know, these kind of secret transmission things. We kind of need to liberalize that a little bit. You know, we make it a little bit more open. We develop an actual curriculum. People don't have to hang out with me at my clinic for 9 years, because that would be a nightmare. You know, like, you know what I mean? It's like, it's logistically not possible. Like it doesn't work anymore in modern society. And so we started kind of modernizing how the traditional ways of learning were going to start being done. Like, and I you know, but I still think that we've been quite successful in people's hearts and minds in creating and provoking the old way of learning, which is like, oh, wow, these moments of like seeing insight and making connections and scrambling your brain and then putting it back together. And then, you know, and I'm not the only one doing this. I'm just talking about my own tradition, right? Like Dr. Tian's tradition, but there's people doing it from other traditions also. Like, you know, like there's other classical doctors out there. My teacher wasn't obviously not the only one who knew Shanghai and not the only one who was teaching other students. You know, in China, Dr. Huang or like other Dr. Feng Shilin, and they have their Western students who are also teaching people and are also fighting the same fight, which is like, let's save Chinese medicine from demise, because otherwise it's just going to become some type of modernized thing that is going to maybe sound good but not work very well, right? And so I do think that ultimately, what style of practice that you will be drawn to, you know, depends largely on how your mind functions, right? And personality traits that's karma in my book. Like that's your karmic connection. So if you're drawn to becoming a Wenbing scholar, or if you're drawn to study Sun Tzu Miao, or if you're drawn to do Nanjing acupuncture, or if you're drawn to Japanese styles of Shanhanen, like Kampo or something like that, you know, using smaller dosages and all that, you know, it's all based on, that's your karmic connection with that teacher. But it's very important you find a teacher. I don't care who it is, but you need to, well, obviously you need to, like in Buddhism, you always have to really critically evaluate the teacher. You have to really, don't just like them because they say nice things to you. Don't just like them because, you know, they look cool or they crack good jokes or stuff like that. No, I mean, you do have to critically evaluate them, because the only way you're really going to learn from such a person is to really follow some traditional learning methodology. And a traditional learning methodology with a traditional style teacher is, you know, there is a hierarchical thing going on. There is like authority, and, you know, you cannot, like, the water doesn't flow uphill. You know, you have to position yourself a little bit lower than the teacher, and then the water flows down. You know, like the virtue of water is that it flows to where there's an openness for it. And so if you're kind of going in there with lots of ego and stuff like that, the teachers is going to feel it. And even if they want to teach you, your mind is not going to be fully open to receive the teaching, because the teaching might come in very strange ways. Like I've had people in clinic with me who have been with me for many years, and they're in clinic with me, and at the end of the day, I apologize to them. I'm like, sorry guys, you know, like for example, Laurie and Steven, you know, who've been with me a long time and who really know what they're doing. They know their shit well. I mean, I'm proud of them. You know, I feel like I've taught them, but they've now taken it to the next level. And so they'll come to clinic with me, and at the end of the day, sometimes I'm like, I'm sorry guys, I feel really bad. Like, you came from so far, and it was kind of an average day. It was a boring day. Like, we didn't get challenging cases. You know, we had a bunch of chai ku, or we, you know, this and that. But they might say all of a sudden, like, no, Arnaud, you don't get it. Like, what you said there with that patient, or the way you did that questioning, that just blew my mind. And that totally gave me some insight in some other patients that I had. So they were learning, and I wasn't even aware that they were learning something. I was actually feeling quite embarrassed that it was such a shitty day. And I felt like, oh my God, like, you know, maybe I should give these guys a refund, you know? But, you know, but actually their mind is in the right place, that they always learn. And if I think back to how it was with my teacher, I always learned. Like, there wasn't a day that I didn't learn something, you know? Like, if your mind is in the right place, you'll learn. So seek out, look around you and see what's out there. Read the classics, and then you'll feel drawn to one thing over the other. You'll kind of start to feel like, oh, this is more interesting than that, or, you know, this is more cool than that. And then you'll be drawn to that. And then as you get more drawn to it, then you seek a teacher. Then you start to inquire with your colleagues, and you start to look around and say, okay, who's out there teaching that? I want to, you know, and then you evaluate that person a little bit. Take a course, ask around, try to get some references from other people who have trained with that person. And you know, like, if you're going to study with me, like, for example, you know, like, I make the most inappropriate jokes. I have a potty mouth. I might have some abrasive aspects to my personality. I mean well, but I'm not perfect, you know? And so some people, like, if you're not going to be okay with that, maybe what might happen is it shuts you down, it shuts you down, and you don't want to learn again.
Well,
you don't want to learn anymore.
When I first came to your first lecture, actually, I was moaning and groaning to one of the guys that was in there. There was only two of us waiting for everyone else. And I turned up, and I didn't know, I came from, you know, Port Macquarie, flew in, didn't know what time was happening, was just like, this was so badly organized. And I was complaining to one of the guys, and he was just listening to me, just nodding his head. And at the end, you know, my blah, blah, this is terribly organized, he said to me, I would rather have a badly organized lecture with fantastic content than the opposite way around. And then just sat down and just, I just shut up and listened at that point. So, and then I see what you're saying. It's really, really true.
Yeah.
So I appreciate.
I mean, the mindset's important. You know, you have to have the right mindset. And so if the need inside you arises, like if you feel the need to get better at what you do, which honestly, if we're going to talk about medical ethics, the most important ethical rule that we should all live by is that we should not rest, we should not cease our study until we're really able to crack every case that appears in front of us. That is the true intention of a true physician. Like, how can you sleep at night when you know that there's a patient at home that you haven't been able to help? Like, it fucking destroys me when that's the case. Now, of course, I'm not gonna like, you do learn to deal with the defeat in clinic. You do learn to, you know, realize that there's going to be things that it's just not up to you to fix, you know, and you can go metaphysical on that as well. But it's true. Like, I am constantly trying to get better at this, because there still are so many, the majority of my patients still don't get better. And it's not because I suck, because I work really hard to be good at what I do, but it's because I try to attract only hard cases, which is, it's a blessing and a curse, right? It's a blessing because if you can make a difference, you've really made a difference in somebody's life. It's a blessing because it keeps me engaged. I don't fall asleep because I'm not being challenged. It keeps me very much on my toes. But it's a curse because very often I sometimes just want to have an easy case, you know, because I'm like, man, I'm so tired of not being able to fix problems. I mean, I'm exaggerating, but you know, you have to be comfortable with the fact that if you're going to work with heavy cases, which is what my training is designed for, is like to teach you to work with heavy cases. You also have to be comfortable with the fact that heavy cases there's a reason why they're called heavy cases, is because they might not get better, or you might be able to make some difference, but not go all the way with them. And that's just how it is. But when the need arises inside of you, you realize like, oh shit, I need to get better at this. Like, I'm not at the level that I want to be at, but that I should be at. So how do I scale that wall? How do you transcend that limitation of my own mind? And so then you have a choice to make. And the choice that I made, which was a very informed choice, don't get me wrong. I didn't just blindly decide that I was gonna study the classics. No, I really looked in all kinds of modern styles of Chinese medicine. I mean, if anything, the modern styles are much more widely available in China than the traditional styles. So I definitely saw a lot more modernization going on in my training than not. And so, but I still realized like, that's not the answer. They're not getting better. They're not really, the doctors are not clear. Their train of thought is not clear. Their clinical results are not there. The only answer, and I'm 100% certain of it, the only answer is to study the classics. You have to go back to the classics. You have to practice this medicine the way it was intended to be practiced. And you have to go back to the old style. And so then you say, okay, I need to do this and I need to find a teacher. And then you look around and you will find who you will be drawn to karmically. And then you follow that teacher, you hanging from their lips, every word that comes out of their mouth, you write it down. You go back, you organize your notes, you study hard, you know, you try the techniques out in clinic. If you have questions, you just pester them with your questions. In China, that's not okay, but in the West, it is. You know, like if you keep sending me questions, I know you're studying. I know you're thinking about it. I know you're not just like, you know, binging on 5 Netflix shows all at the same time. No, I know you're reviewing your formulas at night after work. You know, I know you're engaged. Nothing I want more. Nothing that makes me happier is an engaged student. And so the more you like, you know, have that intention, that mindset, the more you'll get out of me. Whether I want it or not, it's just because your mindset will be in the right place. And you'll learn and you'll get somewhere. You know, you just follow your teacher's advice, because the teacher's been walking through the forest for a very long time. Like I've been doing Shahanlan now for, you know, I started in 1998. So it's 22 years. I'm going on 22 years now of doing Shahanlan. 21 years exclusively under the Tian-Zeng Lineage, right? But let's say 21 years. Let's just call it 21 years of only Shahanlan, only exclusively, right? But that's plus my teacher is whatever, 50 years. And then Dr. Tian's 80 years. And Dr. Tian's older brother's X amount of years. Like that's all embedded within that, you know? And so that's why you follow a tradition and you stick with it. Don't go surfing for teachers. Don't do a couple of years with this one. Yeah, you know, making me work too hard. Then you go jump on the next one, you know, a couple of years, and that doesn't really get anywhere. You know, 10 years later, had you just stuck with one style and every day memorized one formula, man, you would have known those formulas so well. But no, you were too busy going left and right, and then you're still actually nowhere because you took this path and you walked for 10 years, and it actually brought you back where you were when you made the first decision. Every decision you make is a fork in the road, and you better, you know, choose the right one. You better choose the right direction. Otherwise, you're going to waste a lot of time in life. Time in life is so precious. It's just so little of it. Flying by, you know, like you have to do is have children to know how fast time is passing us by, you know? So it's very important. Yeah. Man, I've been talking and talking. Let me just quickly check here. Yeah. So you're going to have to split this one up into 2 sections.
I think we might. So I'll just, I'll pause this one and just say, you know, thank you so much for sharing your inspiration, your incredible work ethic, your experience, your passion. I think it's a huge responsibility that you have in you know, being the lineage holder of this lineage. And yeah, just, you know, I'm so thankful that you're able to explain it to everyone and hold it with such dignity. So thank you so much.